So welcome everybody. I'm Dr. Howard Koh. I'm the Feinberg Professor of the Practice here at the Harvard Chan School of Public Health. It's my great pleasure to welcome you to this very exciting panel today entitled Pathways to Public Service. I'm a professor who has spent over a decade of my life in state and federal public service and government. So I always encourage my students to give public service a try. And so today we have a very inspiring panel of Harvard students and alumni who already have tremendous experience. So I'm delighted to moderate and introduce them to you now. On my immediate right is Audrey Gasteier. She's the Executive Director of the Massachusetts Health Connector. She got her master's degree here in 2008. And then to her right is Oana Jambashu. She's the former health policy advisor to the Health Minister of Romania. Oana got her MPH here in 2022 and is currently a Doctor of Public Health student. And then we have Morissa Henn. She's the Deputy Commissioner of the New Hampshire Department of Health and Human Services. She got her Doctor of Public Health degree here in 2019. And last but not least is Steve Lopez. He's former counselor to the Secretary of the Department of Health and Human Services in the Biden administration in Washington, D.C., and Steve is also currently a Doctor of Public Health student here. So as we begin, we're all considering pathways to public service, what you might do, how you can sustain your motivation, but let's begin at the beginning and talk about why. Why did you get involved in public service, and why did you even give it a try? So Audrey, can you start?
I'd be happy to. Thanks so much for having me. This question is really dear to my heart because it speaks to kind of how I ended up on the trajectory of public service in health policy in the first place. So for me, kind of growing up, I had a really strong instinct towards social justice and cared a lot about fairness. I didn't necessarily have a particular outlet in mind, but that always kind of animated what I was interested in studying, learning about, and doing. And then as I got older into my 20s, I remember the experience of watching the Katrina hurricane, and for me it triggered a concept of the responsibility of government, whether thinking about federal government or other levels of government, and how important it is for people to be able to count on government to visibly or invisibly support the things they need to thrive and be secure in their lives. And then the final kind of twist for me was when I was a student here studying health policy, kind of connecting all those dots around fairness and thinking about health as a component of social justice and economic justice. Massachusetts had just passed its state level health reform, and it was a really exciting time to be around the public sector and the concept of public service because Massachusetts was about to embark on something that was going to help hundreds of thousands and millions of people right here in the state. And we were also conscious that it was going to potentially serve as a proof of concept for something that could be done for the whole country. So all of those kind of observations and experiences really gave me that bug in terms of that interest and what the public sector was capable of. And I was really motivated to want to be a part of it and to be in the center of that work.
Great. Oana?
Well, first of all, it's an honor to be here with you, and thank you for the opportunity to speak to our European public health experts or enthusiasts who might be thinking about pursuing a path in public service. I am first and foremost the mother of a child who was born 17 years ago with a very complex medical condition in Romania. She was given a 10% chance of survival by the age of 1. And the fact that we did not take that as an answer led us to Western Europe and the United States, actually here in Boston, where she received the medical care that she needed. She received the right to live, and I received the realization, the fact that healthcare can be different, but not there where she was born. And with that information, I went back home, and it was impossible. It can be done somewhere, that it means that it can be done back home. So I started an NGO. I started advocating for the rights of children that were born like her with complex medical conditions. And during my advocacy, I was lucky to be invited to talk to the health minister at that time. So I presented to him what needs to be done, what is the budget, what is the work that we need to engage, and what are the outcomes and impact. And he asked me one thing: how much time do you have? And I didn't understand what he meant. I was like, what do you mean about how much time do I have? I want you to stop talking and I want you to start doing. And at that moment, he appointed me as his advisor, which was when I realized I never pursued public service, but I was led into public service because it was the point where I was able to bring the most benefit to people like my daughter that needed healthcare and weren't able to receive it. So this is how I ended up doing public service, and since then I've been doing it with a lot of love and joy in my heart.
Wonderful. Morissa?
Great, thank you, and thank you so much for the opportunity to be here. Being a student here at the Chance School had a huge impact on my desire to go into state government. I was fortunate to get to know our moderator, Dr. Coe, and hearing from folks like him, Dean Turnbull, John McDonough, Bob Blendon, about the ways in which they had found not only a place for their skills and their expertise, but also a true calling in public service, really influenced me to want to develop my career in this space. For me, I previously, as I was finishing up my DRPH, I went to the state of Utah for about 5 years, and my work there was largely around the topic of suicide prevention and gun violence, and really bringing public health solutions to the two. We discovered the only way to make progress on that issue was by bringing public health leaders together with gun owners, a sort of unlikely collaboration, but truly the only way that we would move the dial on this public health problem was by collaborating with the people some would say were most in the opposite polemic, and in fact the teams there made huge progress. Coming home to my home state of New Hampshire to serve in health and human services leadership, the same model of finding common ground and bringing strange bedfellows together has been such a meaningful path. I've learned that the people who may at first appear to be your adversaries often turn out to be the exact folks who you most need at the table to build connection and trust. So whether it's working with foster families and really learning from them about their experiences and how their impact, their lived experience can drive policy, whether it's improving our mental health system, again, by talking with families and by understanding from providers really how the systems are broken and where they need to be fixed, bringing folks together across seemingly vast divides has been the why for me.
Tremendous. That's great. Steve?
Thank you, Dr. Cohen. Similarly, thank you for the opportunity to be here today. I'm originally from California, from a region of the state called the Central Valley. It's primarily an agricultural region, so there must be some fruit, nut, dairy product that has passed by your table that was likely touched by folks back in the valley. My parents were born in California, and as teens and young adults, they spent their summer months as migrant farm workers, helping their families to make ends meet. And my dad ultimately retired as a grocery store clerk, and my mom retired as a cafeteria worker in the public school system. But I remember, we came from modest means, but I remember regularly my parents giving of their time and talent to help others in need, and that had a profound influence on me. They were my first models of what it means to serve, and that was their sort of encouragement to myself and my siblings, right? How can you use your time and talents to better the lives of others? And I've taken that forward with everything that I've done, whether it's academically, professionally, or even in my personal space, how to make sure that more families like mine, the son of a grocery store clerk and a cafeteria worker, have greater opportunities to be healthy and thrive. And it's not lost on me that in one generation, I was able to advise the first Latino Secretary of Health in this nation, right? I don't know if my parents had ever imagined that dream, but I know if it were not for my parents and their example, I wouldn't have had the opportunities that I've had. And it's my charge now to make sure that more folks, that my story isn't unique, right? That more folks have those same opportunities.
Wow, what a moving set of responses. Wow, fantastic. I love asking the question why. You always get these deeply personal and very moving responses and lots of stories about family and advocacy and calling, so that's fantastic. So another big question for all of you, I'm sure you can relate to this, is that everyone knows that working in public health these days is really tough. Especially for those of you who are or have been in the trenches. And many people view our field with mistrust or exhaustion or even outright hostility. So can you share some of the difficult moments you've encountered in your career to date? And then what keeps you going through those tough times? What keeps you motivated, and how do you take care of yourself? So Juana, you want to start with this one?
This is very interesting because I usually say that I suffer from amnesia because I do not remember when it was hard. I don't remember the hard times, but I can speak to what keeps me remembering why I'm doing this. It was after my first policy passed. The government that I was working on was voted out. I was an appointee, so I left the office. And I think it was a month or a month and a half after that I received a phone call from a man. I did not know who that person was. He said, "Are you this person?" I said, "Yes. I want to thank you. My daughter was born a few days ago, and she received the hearing screening that it was implemented by the government and it was the policy that I was leading. It was my first policy. And she needs immediate medical care because otherwise she won't hear for the rest of their life." That moment, besides the fact that that's a lot of privacy breach, but he got my phone number and he thanked me for that. And that is something that I never got the chance to do for my own daughter who's deaf. So that is something that keeps me in check all the times, that phone call and these people that you can touch without knowing. And of course, it's been months of working on how do you get 175 hospitals to do the procedure, to buy the equipment, to finish the procurement and get everything implemented. So by the time that the policy is ready, you can do something. But that fades in comparison to the moment when one father calls you and says, "Thank you for what you've done." It's
Wonderful.
It fades.
Very nice. Morissa,
Yeah.
some tough moments? Right?
I was telling the panel over lunch that my first meeting in government with our governor and other key leaders had to be shut down because people who were advocating against vaccines and against masking were present and were taking over the meeting, and so I had to be escorted to my car by a state trooper. And I thought, well, this is an interesting career choice I've made. But at the end of the day, I think for me, that has not always been the case. As I said before, working with people very different than myself has more often than not actually been very strengthening to the work, very empowering. And I think curiosity is the value that or the way of being that I talk about the most. That when you're curious about something, everything can become a learning experience, no matter how challenging or personal it can feel. And I think having that learning mindset is something that allows us to be resilient and, as Juana said, sort of to have that amnesia about the hard days because things sort of become more interesting. That's not to say others aren't more personally affected. Even your own story of personal impact is so profound. But I think at a time when trust in public institutions, public health, public sector is so low, it's really important to develop support and a community so that you don't take things personally. And for me, curiosity is sort of the antidote to taking things personally.
Great. Steve?
Maybe building upon that. So as counselor to the secretary, there are about 90,000 employees at the Department of Health and Human Services. The secretary can't be everywhere. And so he has this senior team of about 8 people who are charged with being the intermediaries between him and senior leaders. And so we each had a portfolio. Someone had the CDC, someone had the FDA. I had HRSA as one, community health centers that they primarily bear responsibility for. But I think, as you ascend in your career, the level of accountability also increases. When things go well, you get the pat on the back. When they don't, you get the call or you're invited to the meeting to do the debrief. But one of the things that I learned, and I'm still learning, but to Morissa's point, is how not to internalize things as much and to be able to understand what is mine and what is my responsibility, and then what are the things that it's because of the system that I'm operating in or the structures that we're operating in, that's what is causing these challenges. And that has been incredibly helpful, especially on those days where it's just really tough. I think about the FDR quote about the man in the arena, and if you haven't read it yet, please do so, because it talks about public service being, it can be a pretty brutal place. But it's one thing to be a spectator, it's another to be in it, to proudly wear those bruises because you're doing it for the right reasons.
That's great. Audrey?
echo all of those sentiments. I have had the experience of having serious adversity in the roles I've occupied, working at the state's health insurance marketplace, have been through tough chapters with the Affordable Care Act, major technological challenges, implementations that haven't gone the way have been expected, have been on the cover of the newspaper, and just sort of dealing with kind of the fits and starts of progress and what that looks and feels like on the ground. And you are the face of that. You do have to take that when things don't go right. What I have found sustains me in that is really centering the people you're there to serve. Any one of us are in the roles we are in the public sector, or roles we've held, because something otherwise wouldn't work well for the public if you and your organization weren't there doing the very best you could. And that's not always going to go perfectly, and it might zig and zag to some extent. But centering those people you're there to support and your role is there to support, I find very sustaining. And also trying to kind of reframe, there are days when it really is a slog, but sort of reframing the work from I have to deal with this problem to I get to deal with this problem. Someone has to, and I want it to be people like me who care and are going to lose sleep and are going to try new things and be intolerant of things not working well for the people that they need to work better for. So that kind of shift in mindset, I find I'm always able to kind of revert back to, and keep myself moving forward.
Well, you're fascinating, all of you. You know, I have found through my career studying leaders, when I ask, how do you get through the tough times? They all give some version of the answer. We try not to take it personally and focus on the mission, and know if criticism comes, it's not at us as people, but it's the situation we're in. So it's fascinating to hear all of you say some version of that. Let's move on to the next question, and again on the challenges of service. When you're working in government, how do you manage situations when your views diverge from those of the leaders you report to? And then what strategies have you found most useful for working across partisan divides? So Morissa, you want to start with that one?
Sure. So I mentioned Bob Blendon, who is, I think, soon to be Professor Emeritus. And if there was any course that I took in my DRPH program that has stuck with me, that I think about literally every week, it is his political strategy course. What Professor Blendon gave students, including myself, the ability to do was to understand that the things that we know in health policy, like the principles around equity and how things get done, that's not always how it works in the real world. And some of the framing and some of the values underlying that, you need to tease apart in order to meet your audience where they are. And so an example of that, so one of the so he has a slide literally on day one, Dr. Blendon, that had, health equity and diversity and inclusion, and and then it included kind of what would be another way of framing it. And so in my work, one of the things I'm really excited about that my team is working on right now is transforming New Hampshire's juvenile justice system. It is, I would say, one of the biggest ways in which health equity and population health are making progress in the Granite State. Far too many Black and brown kids are represented very disproportionately in our juvenile justice system, and we, through reform to our court system, to our practices, to our case practice, and working with families, have managed to become the state with the lowest rate of juvenile incarceration in the country, which is not the state that you would imagine is locking up the lowest proportion of kids, but we've done it by appealing to values of fairness, appealing to families being self-sufficient and seeking resources for themselves versus needing to rely on outside institutions, by framing certain harm reduction as part of a comprehensive holistic strategy. So my point is, without Bob Blendon's teaching and the community that he created, I wouldn't have had the fluency with which to translate many of these common ground principles to a set of efforts in a more conservative leading state that everyone can get behind.
Fascinating. Steve?
So I mentioned my role as counselor of portfolios. I also had the Indian Health Service. And so this is a health system that provides care to the over 400 federally recognized tribes in the US. One of the things that we had been trying, many administrations have been trying to secure stable funding for the Indian Health Service, woefully underfunded. A priority of the White House and Secretary Becerra's was to get that funding through Congress. And the Secretary had to work in a bipartisan way and identify champions who may not have been politically aligned, right? But they shared common sort of value and purpose around the health of those in Indian country. Long story short, we were able to get a down payment of $5 billion for the Indian Health Service, with the goal of building upon that initial down payment. But it was an example for me, though, of the ways in which you can identify folks who share common purpose, right? Who may have different thoughts about how to get right to that goal, but have identified that it's something that can potentially be workable, right? And how do you build upon maybe that initial success to find greater opportunities for greater impact? But that's something that I will certainly look back on and be proud of, and be proud that I was able to support this administration's efforts to secure that win for Native Americans.
That's great. Thank you. Audrey?
I think it's such a great question, and I think really salient for a lot of folks right now. I would say, I hate to sort of overly romanticize Massachusetts, but I do just want to remark, having gotten to kind of professionally grow up around Massachusetts health reform and how it came to be. For folks who don't know the history, it was this really interesting alliance between the business community, progressive patient advocacy groups, hospitals, payers, state government, the federal government, and it was done, interestingly, with a Republican governor, with a Republican federal administration negotiating a Medicaid waiver that would finance a lot of this work. But being on the ground, I can tell you, there were people with really different political instincts who were working to tackle a similar issue. There was a similar kind of kernel of whether you were a business and you were worried about people being uninsured because it made for a less productive workforce or a more sluggish economy, or you were a progressive advocacy group and you cared about it from an equity and fairness and access perspective. We were able to craft conversations and coalitions on the ground where people were really listening to each other and finding those places where, you know what, maybe we disagree here, but maybe this box we can work together and come up with a really creative solution that can work. So I've lived that, I've seen that work, and just kind of a plug for state government. I think state government is a place where you can see that in really stark relief because the players are all really close to each other and they have to kind of live with each other in a particular way. And then the last comment I want to make is I had a boss and mentor once who used this phrase, aligned but not identical, to describe situations where you may say to yourself, I'm not really on board with this person's kind of whole ideological vision, but I can find a place of alignment. So kind of living in that space of aligned but not identical. And I look for that in places because it's more present than you might think.
Great. Juana?
I echo Morissa's thought about Professor Blendon's class. I also took that class and I loved it, and he's been instrumental in my career since. I agree with Audrey and Stephen. Bringing people together is very important, and one thing that I think was very important for me is that I was an appointee in different governments with different political views. And I worked with different health ministers holding different political views that at sometimes were not aligning with my political understanding of how the world can advance. And what I found very interesting in developing the policies, I was in charge of leading national policy development and implementation. And what I found most useful was to understand all the stakeholders. Is it political? Is it public sector? Is it private sector? Is it professional sector? Trying to talk to everybody, understand where they're coming from, because we have the same why and we have the same who. We want to do good and we want to serve the people. So having an understanding of how things work and then bringing them all the table. Sometimes I would just let them talk among each other, and they would find at the end of 4 or 5 hours meetings, they would agree on something. As Audrey was saying, it's not identical, but it was something that was coming out of that meeting, and then we would just advance from there. So it's easier said than done, but it worked. It works, and I've seen it happening in my own practice.
Great. Okay, when you're in public service, everybody gives you advice. So here's a question for all of you. What's the best and worst piece of advice you've ever gotten? Anybody can start this one.
I'm happy to start. I'll do it. So the worst piece of advice I got, and this is kind of specific to a particular situation, but was don't worry about health policy in the rest of the country, just worry about Massachusetts. And I ignored the advice, but it came from somebody that I kind of respected and had a lot of wisdom and experience, but I'm glad I didn't. The particular work I do, it is executed at the state level, but we're very enmeshed with federal health policy. And so, our most powerful steps forward have been when the whole country is moving in one direction, and I think it's important that states help each other. You need to do the best you can at the state level on the ground. But I'm glad I ignored that advice, because a lot of my most kind of powerful, treasured professional memories are actually working across states with my fellow directors of state-based marketplaces and folks who work on the Affordable Care Act. And there's a lot of power in the diversity of states who are committed to expanding coverage using the Affordable Care Act. So I'm glad for those bonds, and not just thinking about what can we do in our corner while still maximizing the most we can do here. So that was the worst advice I ever got. The best advice I ever got was in state government and in public service, endurance is everything. And you have to be ready to really dig deep and think about it like a marathon. It's not a constellation of little wins. Those can be great. But the people and the ideas that tend to stick and have the most sustainability and durability are the ones that people stick with for a really long time. And it's a slow burn and it's a slow build. And so you have to be ready with that kind of wiring and mentality. And so that was advice I got relatively early on in my state government career, and it has proven very true.
Fascinating. Okay, others?
I think I would say that starting with the worst, because I like you did that, was become known for something. I think there's often a pressure, especially when you're in doctoral studies, but really at any fine institution, to sort of define your own niche and become kind of known for something. And while that can serve you to an extent, I think what I have learned is it's really in empowering teams and watching others develop, and in building relationships where the most lasting and sustainable work lies. And that leads to sort of, I think, the best advice, which is just be super kind to people. Not only is everyone carrying burdens and challenges, regardless of their place in your career and in their life, but ultimately that's what people are going to remember you for, is not how smart you were or what great policy you generated or legislation you wrote. It's going to be really, did you make them feel valued and seen? And I think the teaming lends itself to that, and minimizing one's own need for credit lends itself to that.
So I have two. One, listen more than you speak. I think that can be incredibly helpful. I think, and I've tried to practice that both in personal and career. And the second is taking the long view. Some things that you may be working on, you're never going to see sort of the trees that you plant sometimes, but taking the long view and knowing that you're working toward this bigger goal is going to be helpful, especially when in a immediate term, you're not going to see those wins occur, but you have this vision of what you're aspiring to. That's been helpful.
I think I have two bad advices. One was something that is, I took a print screen of it and I'm keeping it. We will have a personal life when we leave office. And that was something that led me to burnout. And nobody should ever do that. Take care of yourself. Make sure that you find time to be healthy, both spiritually and physically. And the second one was don't. And don't do it. I wanted to join the Health Commission in the Chamber of Deputies. I was offered this opportunity and I was told don't do it. And I listened to my heart and my instincts and not to the words that I was being told. And I did. And it was amazing because it enriched my vision of how policy is being built, because the legislative arm has a very strong say on how legislation is being developed, and the executive how it's being implemented. So now I had the advocacy, the legislative and executive experience that allow me to have a much broader and richer understanding of why and why are people or stakeholders acting a specific way. So enlarging my vision allowed me to do better.
Fantastic. So I have the final question in the online part of this session. It's lightning round. If you can answer in one sentence, if you could go back in time, what advice would you give yourself before embarking on a public health and public service career? Who wants to start with that one? One sentence.
I'm happy to start. Identify what brings you joy and prioritize it.
Great.
I would say find your mentors and find your tribe.
I would say doubt less and trust yourself more and your instincts more.
Wonderful.
I would say buckle up and stick with it.
So to my astonishment, this is the end of the online session, and I think this is the most incredibly inspiring group of folks. How about a big round of applause for them, right? I know we're all so very, very proud of you. Thank you so much for taking time to share your thoughts and experiences with us. If you missed any part of this program, you can view it on demand at the YouTube channel for the Harvard Chan School online. But thank you so much for your time and attention. You know, what we're very proud of at the school is that we support leaders and we learn from young leaders like you. And I really hope we have more sessions like this because it's going to change the world. So thank you so much. One more round of applause here.